Good morning, everybody. I think the important thing to say about my background, so you understand where I'm coming from, is that I run a service for children with a background of abuse and neglect. That's the service that I run. About 25% of those we assess for autism. So I'm quite often, thinking about this question, is it autism or is it abuse? So what I would like to do in this talk is to go over a bit about autism and coming at it from a clinician's point of view rather than, the way that Robin has so brilliantly described it from the sort of inside out. And then I'm going to move on to talk about how children who have been abused and neglected present, how you might recognize some of what they show you. And then talk about some of the areas where, they may look a bit alike, there may be some confusion. Okay, Robin has covered really very, very well what is an autistic spectrum disorder, and she's really captured the fact that it is a, thank you, thank you. I'll keep clicking it. That it is a spectrum, and that there's huge variety, and that at the very, very mild end of it, it actually merges with the normal population. So most of us know someone who's, just a little bit, or, has some of those difficulties, but is coping very well. So it just merges into people who've got milder difficulties and then into some people who have significant learning difficulty, who have more difficulty getting on in life. And Robin has outlined the main sort of the triad and the main sort of areas, but this is essentially what we look at when we're trying to make a diagnosis of autism. So we want, I'll go into this in more detail, but we want to see that someone is having real difficulties in social communication and interaction, that they have these restricted, repetitive patterns of behaviors and interests. It starts very early on, almost always before 2.5, there's some signs, and that it really causes quite a degree of impairment in getting on with life. It makes life difficult in some way or other. And though that is the way one looks at it to make a diagnosis of autism. It's really important to say that this is a neurodevelopmental disorder. So it is absolutely not caused by parenting problems. And that's probably one of the most important messages to take away. It's no more caused by parenting problems than a physical illness, a learning problem, or anything else. It really is something that's innate. And there can be a number of causes for it, but certainly genetic inheritance can play a role. It's not uncommon to see in families that someone may have autism and other relatives have perhaps some traits. It's much more common in males than in females, and in about 2/3 there may be some form of learning disability. Very often, autism isn't the only problem. With any neurodevelopmental disorder, it's likely that there may be some other kind of difficulty. And I'll describe that in a little later. I know that a lot of you are very well read from the show of hands, so some of this may be a repetition. I just want to describe a little bit about the social communication problems in autism and how we pick them up. When we're asking parents about the early years, we ask them what they were like as a baby, what their child was like as a baby. Did they seem off a little bit in their own world, or were they really orientated to people around them? And then when they were a bit older, did they babble away the way babies do? Before children have acquired language, they have this sort of baby talk, and it has inflections, and it sounds as if it's almost language, but not quite. has a sort of musical, talkative feel to it, even though it isn't proper language. And what is very typical about interactions between parents and their young children at this stage is that sort of game playing that goes on, peekaboo or whatever, reciprocal games. And little chats, conversations between mothers and babies even before language is acquired. In autistic children, you may not get that. So that those very, very early signs of social reciprocity may not be there. And those early signs of normal language development may not be there. And then as they get older, what is striking is that even though language may proceed normally, it may not, but it may, it's the social communication that isn't, that is not quite the same. So sometimes it's eye contact. We rely so much in communication on non-verbal aspects of communication, if you think about it. If you think about how much we express through eye contact, body language, reading of gestures, facial expressions, that's a huge part of how we communicate. And that's the area that is affected. So it's much more difficult for autistic people to read others, but also to communicate themselves. And they may not recognize certain facial expressions. They may not be able to read them as that person is angry, that person is whatever. Their range of facial expressions and gestures may be much reduced. And some of them don't express the same range of facial expressions. So some autistic children, for example, may be angry but look quite blank. So it's also how they themselves will communicate how they're feeling that is affected. So obviously that has an impact on relationships. And relationships generally may be very hard to understand because so much of relationships is understood at a sort of underground level. It's something that we just pick up. We pick up the rules of social behavior. We don't even understand how we pick it up, but we do. And if this social communication is affected, then learning about social context just becomes much more difficult. So learning that actually if you haven't seen someone for a while, you're meant to smile at them. Or, if you come home from school, and you haven't seen your parents all day, you might greet them, or you say goodbye to people, or all that may have to be learned rather than just absorbed. So that's what we mean by social communication difficulties. The next major area, and it doesn't really, you don't have to worry about classification systems, I wouldn't bother with it really, but they've sort of, in the newest one, they've shrunk the triad into two, but it really doesn't matter. So there's two large areas in the most recent classification system, and this is the second big area, and it's to do with restricted, repetitive patterns of behaviors, interests, and activities. So this has, they've lumped it all together into one, but actually there's an awful lot of different bits to this. So young children, there may be a huge amount of sameness and repetition to their play patterns, for example. So you get the child who's fixated on Thomas the Tank and watches the same video again and again and again, never seeming to be bored of it. Or you get the child who doesn't seem to have elaborate imaginative play, but instead lines up their toys or organizes them into a pattern. Children may be very resistant to change, quite inflexible, and need quite a lot of preparation for change. So that may be, for example, a supply teacher comes in one day, and a child is completely thrown by that. Or many children because many autistic children often have real abilities that are highly developed in some areas. And many children are very good at the spatial bits. They're very good at puzzles, and they're very good at remembering routes, that is, in a car. And so they know the route to school. And if one day the car goes a different way, that can be very upsetting. So there's something about a need for sameness that is very important. Children and young people may have fixations, particular interests that just preoccupy their mind, and they don't like going off that topic. So if you have a conversation with them, somehow it always comes back to, trains or dinosaurs or whatever it is. And they can acquire a huge amount of factual information about these interests. They can be phenomenal, really, in terms of what they remember about them. But they often have an odd feeling to them. So just in the last few weeks, for example, I have seen one child, I think he was about 8, who was fixated by headlamps of cars. And he loved to, when he was driving along the motorway, look at a headlamp, especially at night, because that was more challenging, and he could tell what kind of car it was. And he was really preoccupied by these headlamps. Or I saw another child who's about 7 who was fixated by mops and had been ever since he was about 2, kitchen mops. And really, nothing else would do. So a reward for him was being allowed to hold this mop. So, they often have a slightly unusual character, these interests. It's also a huge source of strength because some people become real experts in a certain field, especially, a field that requires, a highly developed memory and understanding of something. That can be a real strength, and sometimes it's where they end up in life. Robin has already mentioned the sensory stuff, and I think I get to that a bit later, so I think I'll move on. Just a quick word about how we go about diagnosing autism. You probably know, but what we would do is take a very, very detailed history from the parents or from whoever knows the child very, very well. We'd also want to speak to the school because the school have a fantastic view on how a child is with their peers and away from the family. So they can give us a really useful perspective on their social development. And then, of course, we also have some standardized observations that we do. We do play sessions with them and see whether they can share, turn take, how developed their imaginative play is, and so on. And there are certain standardized tools that we use to do that. So that's how we go about it. So I want to move now on to the whole area of abuse and why it might be, why autism can sometimes be confused with abuse. I think there's, I found this topic quite interesting, actually, because it did make me think a lot about why there might be some confusion. And I thought about it from the point of view of a teacher in school, for example. And it's true that in both groups, autistic children and maltreated children, behavior can be strikingly odd or unusual. Autistic children can appear withdrawn or unhappy at school because there's so many things that they're struggling with. Both groups may have abnormal social development, and both groups can have complex presentations with similar behavior. So I'll look at that in a little bit more detail. I also wondered, and this is just a reflection, and I don't know if it's true, but I thought to myself that there has been an awful lot of safeguarding awareness training that has gone on quite rightly for professionals. It's been, I think we've all had safeguarding very much on our minds. And I wondered whether we were providing the same level of training for neurodevelopmental disorders, so that it's possible that frontline professionals think of safeguarding first and neurodevelopmental disorders second. I don't know. I just put that out there because I wondered about it. So let's move on to thinking about children with a background of abuse and neglect. There's no typical presentation of a child who's had this kind of background. It can present in all sorts of different ways, and I'll take you through some of them. But what's really important to know is that maltreatment often starts when children are very young. A lot of it happens within families, sadly. A lot of it is happening between a parent and a child, and it starts very young. And because of that, it affects really core developmental processes that start very, very early. If you like, the foundations of development, which happen in the first few years, can be affected. And that can have really a profound impact on a child's development. So, this is where it gets a little bit confusing because, autism starts before 2.5, and we also have children who are maltreated who are probably showing signs of their development being affected very, very early. So really, because abuse and neglect starts from birth, it can do. So how do we recognize children who've been abused or neglected? What are the sort of signs that might alert us? Thinking first of all about emotions, one of the hallmarks of children who've been abused, quite understandably, is that they're very insecure in their relationships. They often have low self-esteem. And they have what we refer to as poor emotional regulation, which means they have sudden mood changes and they'll fly off the handle very easily. And the reason that we think they have that is that very, very early infant, I'll say mother, but infant carer relationship didn't do what it should have done. So normally, if things are going well, when an infant screams or cries or is distressed, which they do because that's how they show how they're feeling, a parent will usually move in very quickly to soothe them. And they will accurately read what's going on and is it a nappy change? Are they hungry? Are they too hot? Are they bored? What is it? And they usually a good parent is very sensitive and will sensitively read what is going on for the infant and respond quickly and in the right way. Parents who are struggling to be good parents, it may simply be that they have mental health issues, they're preoccupied by their own issues. It may be that they themselves were abused and they've got very bad models of parenting for whatever reason. They may not respond well to these children. So you don't get the kind of sensitive responsiveness that you need for normal development to occur. And we think that is why they don't learn the capacity to self-regulate, because if their needs are always met day in, day out, they learn to internalize that. They learn to self-soothe. Whereas if they don't get that, you have a real risk of emotional dysregulation. And they also may appear depressed or aggressive because they're extremely vulnerable, not having had their own emotional needs met, to all sorts of emotional problems. Typically, they may find it very difficult to talk about how they're feeling and to identify their emotions. Now, that may be rather similar to autistic children. The reason, however, here that they're finding it difficult is that no one's ever done it with them. So again, parents who are attuned to their children, who are bringing them up well, will try to teach them about what's going on in life. And often they'll have emotional conversations from quite a young age. When they're reading storybooks or when things happen, they'll say, oh, so-and-so's sad because, that's happened. Or, these are the conversations that people have with their children, and that's what teaches them an emotional language and teaches them to make sense of the world. Maltreated children often haven't had that. So they don't have that kind of emotional language, and that makes it much more difficult for them to tell everybody what's going on for them. So The next area that is affected is attachment. And I suspect most of you have heard about this word attachment because it tends to be talked about quite a lot. But what we mean by it is that the very, very close bond that is formed between infants and their primary carers, it's innate. It's in animals as well. It's one of these biological innate things. And all children will, when stressed, want to get very close to their carer. So you'll see this all the time. A child who's distressed will run to be close to their carer. And that's what we mean by attachment. It's normal and instinctive. And it's activated when a child is under threat. Unfortunately, if this early parent-infant relationship doesn't go well, as I've described, it doesn't in abused children, that attachment process doesn't go very well either. So instead of being secure and trusting about people, these children grow up mistrustful and not confident that their needs will be met in relationships, and that can persist for the rest of their lives because what happens early on tends to have a strong influence in how we behave later in life. So I think I've said this, really. Attachment is regarded as one of the building blocks of development. It happens particularly up to the age of 3. It's not said in concrete. That's not to say that people can't move on if they've had a difficult early experience. They can. They may find a partner or friends, who help them. But it's very influential. So I think I've said this, really. It does have a huge knock-on effect on peer relationships. So children who've got very insecure attachment relationships are less confident and less competent socially, and they may struggle to work independently in school. They need a lot more support and propping up. Okay, these are some of the abnormalities in social development that you see in children with a background of maltreatment. Poor social skills are common, and again, there's been poor modeling, often in the home. There may be violence in the home, which is not a good model for how to resolve conflict. They may not have been given the opportunities to socialize with peers. And also, if there's abuse going on at home, they may become very hypervigilant and fearful, which obviously affects their relationships. This is one aspect of social development that can look very similar to autism and is often confused. We think it's something to do with children who are in an abusive environment not really properly learning about stranger anxiety and also not having a very secure attachment. So they become very muddled about who they're close to and who they can trust and who they can't. So what we see is children who are quite disinhibited socially and indiscriminate about who they'll go up to. They don't seem to have the normal stranger anxiety that other children have. Now, that can look very similar to some autistic children who could be quite friendly and, but not have that sense of who to speak to and who not to. I think it's definitely an area of overlap where there can be some confusion. And in schools, I know some of you are teachers. They can have a similar pattern of difficulties. So maltreated children often underachieve, usually underachieve compared to their potential. And there are many, many reasons for that. But they have difficulty working independently. They may have poor concentration. They usually have poor educational support at home. And they have higher rates of specific learning difficulties and speech and language problems. So it's well known that children with this background will struggle at school. And then behavioural issues. I've already mentioned the short fuse. the problem in self-regulation. Aggression can also be common and can be common in both. Some autistic children, mainly because they're anxious in new situations and they feel overwhelmed, may look aggressive or act aggressively. And similarly, children with a background of abuse may have problems with aggression, possibly because they're seeing it at home. There can be all sorts of reasons. We often see oppositional behavior and conduct problems in children with a background of abuse, and we often see this thing called ADHD, which just really means problems with concentration, sustaining focus, and sometimes physical restlessness as well, trouble sitting still. And that can be common in both autism and in children with a background of adversity. So they share a lot of common sort of additional problems, if you like, and sometimes it's those problems that people focus on rather than the core underlying problem. So let's look at some of the similarities between both, and just to summarize them really. So social development is affected in both. Both may have poor emotional regulation, both have educational difficulties, and both groups have a similar range of mental health presentations. I'm now going to just look at a few of the common things and think about how they're a bit similar. The inflexibility, we've already heard that autistic children can be rigid, prefer set routines and predictability. But we also see this in maltreated children, and the reason for very different reasons. The reasons may be because by the time they come into care, they've had so much unpredictability in their lives and so many changes of foster placement and so on, that they can look very, very similar. They can be very resistant to change, very controlling. The controlling tends to be because of the profound insecurity that they experience. They try and control their environment very tightly. So superficially, that can look a little bit similar. Self-harm, which is of course a common problem in child mental health generally, as you probably are aware, there is an increased risk in maltreated children. It can occur in children with autism as well. In autistic children, it may be, again, because they are completely overwhelmed and overloaded by what they're trying to take in and understand. And they may react in a number of different ways to cope with that. It can be a sudden tantrum, it can be a freezing, it can be, but some children do self-harm to try and get rid of that tension. The sensory issues have already been talked about. Sensitivity to noise and texture. So what we see in very young autistic children is often a preoccupation by with sensory things. They may find ordinary household noises very hard to cope with, and you see them putting their hands over their ears when the Hoover is on, for example. Or they're very fascinated by certain aspects of spinning, the washing machine spinning, or the wheels spinning of toys, things like that. Very texture sensitive, may come up and stroke something that they enjoy the texture of. Maybe very, very fussy about their own clothes, can't tolerate a label. The labels have to be cut out, or, will wear only that set of clothing, but nothing else. Or when it comes to food, very texture sensitive. And I don't know if any of you have seen this wonderful film, The Imitation Game, that has just come out, but there's a wonderful scene in one of the characters when he's young, gets terribly, terribly upset because the carrots and peas have touched on his plate. And that, that's very classic. What is less well known is that maltreated children also have sensory issues. So they have abnormal pain tolerance, and they also very commonly have sensory processing issues. Sleep problems. All children with neurodevelopmental problems can have sleep difficulties, very common. Let's go back. Sleep problems are very common in maltreated children for different reasons. Maltreated children often because they experience a lot of anxiety, and going to bed and being alone is a time when a lot of the anxiety comes into their minds and they have difficulty sleeping. Feeding problem, I think I've probably covered that. Feeding problems are very common. We have a feeding disorder clinic at Great Ormond Street, and a large number of the children in it are on the spectrum. And sometimes, it becomes quite a difficult problem. Interestingly, though, they often don't lose weight, even though they don't eat the usual things. It's an interesting thing. But feeding and eating problems are also seen in children with a background of abuse. But they're quite different. The pattern is different. So what we see is something that looks very emotionally driven. When children come into care, foster carers may say they binge, they eat and eat and eat and eat. They don't seem to ever feel sated, and that's probably either because they didn't know where their next meal was coming from, or because they're trying to get through food something that they didn't get emotionally. So you see binging, you see stealing and hoarding of food, and occasionally eating non-food substances. So you do also have an abnormal relationship with food in this group. Both, interestingly, tend to maintain normal weight, which is odd. Hard to explain. And I think I've already covered this, that autistic children who are disinhibited in their social interactions can look very similar to maltreated children. And I think I've covered this too, really, that all these problems are very common in both groups. So, now, John said earlier that abuse is much more common in children with disabilities, and that is certainly true. So we can have both abuse and autism. Autistic children are more likely to be abused. They're far more vulnerable. I've talked about their lack of stranger anxiety, their disinhibition, their misreading of social cues. You can well imagine how that would lead to vulnerability to abuse. Interestingly, there are more autistic children also in the in-care population than in the normal community. And we think this may be partly because parents find it harder to look after them, and professionals may not understand what they're dealing with, and they may not get enough support. There may be lots of reasons. But it's just a fact that there are more children with autism in the in-care population compared to the community. So, yes, we can have both, and that's something that we need to think about. Shouldn't just think about either or. How's my time doing? I think I'm all right. Well, I was just going to mention, really, a case that I saw very recently. I'll just mention it very quickly. Just telling you that professionals can find it very hard to tell the difference. We have recently seen a 5-year-old child who had a history of speech delay. And professionals thought probably that was because he was exposed to 3 languages simultaneously when he was growing up, and that would be difficult for every child. And there were other stresses, and they thought that was probably what was causing the speech delay. But then, when he was 4, he just began to regress and lose skills. He lost language. He began he had been toilet trained. He lost that. He lost all sorts of things. He became very withdrawn. He wasn't interacting with his environment, lost social skills, and seemed more anxious and clingy. Now, there were a number of possible reasons. His mum said that his dad had shouted, the parents had separated very acrimoniously. The mum said that dad used to shout and scream, and that the child had seen it, and that he was traumatized. Now, he might have been traumatized, because we do sometimes see a regression from trauma, emotional trauma like that. Another professor saw him and said, no, this is a disintegrative disorder, et cetera, I won't go into what that is. And somebody else said, no, this is autism, but it's just a late regression. Because normally if you're going to see a loss of language skills, which you can see in autism, it's before the age of 2.5, and this was 4, so it's late. So it's a puzzle. It's a bit of a puzzle, and it may be a bit of a number of things. But I just wanted to say that, this happens. It's not always easy to tell what's going on. You can have mixed pictures. And finally, I just wanted to talk about autism as factitious illness. And I don't know if you know what factitious and induced illness is, but because this is a safeguarding conference, I'm just going to mention it. It used to be called Munchausen's by proxy, which may be a name that you're more familiar with. But this occurs when a carer, usually the mother, presents her child as having medical or psychiatric problems when there's no real basis for it. This isn't just an over-anxious mother, because usually there is some degree of deception or falsifying accounts. That's what we mean by that. Part of the picture may be, it may not just be a medical diagnosis, it may be a psychiatric diagnosis that's presented. This isn't common, and the background of these mothers often is one of personality disorder and somatization disorder and difficult backgrounds themselves. But obviously, when we do an assessment of autism, we have to be very careful to do it very thoroughly and properly. So that's why we always pay a lot of attention to what parents tell us. We do. We take a very detailed developmental history. But we would also rely also on our own careful observation and on school observation as well. That's where you want multi-sources of information. So I think I'm nearing the end, and I'm leaving you some time for questions. So to summarize, children with abuse and neglect do have inherently a normal capacity for social reciprocity and responsiveness, but it has been affected by their experiences, which is very, very, very different to the situation of an autistic child who has an innate difficulty in a normal social interaction. And there are certain specific sort of very characteristic features of autistic children that Robin has described, the sort of fixations with certain slightly unusual interests. Sometimes language is a little unusual. It can sound a bit more stilted or stiff, or use idiosyncratic phrases. So there are certain very specific things about autism that you wouldn't see in a child with abuse. One of the confusions, I think, and where parents may find themselves sort of under suspicion for abuse, is because parents may say that the child's behavior is worse at home than at school, and people think, why is that? We don't get that problem at school. But there are good reasons why a parent might find things more difficult at home. Very often the child sort of manages to keep it together during school. And also school life is quite structured, and they learn, the routine. And teachers can become very good at, giving them visual cues and getting them through the day. But it takes its toll. So by the time they get home, all of that feeling overwhelmed and tense and getting through the day, just it may manifest itself in a number of different ways, and there may be a blowout, or there may be, something that parents have to deal with at the end of the day. And we see this a lot. We see this in not just autism, we see it in ADHD, all sorts of things. So that's not necessarily something that would worry us. We would take that into account. Right, I think I have got to the end. Just to say, it is a difficult balance for professionals, because you must be alert to safeguarding issues. We all must be. But I think that the lesson from all of this is not to leap to a conclusion. Just to keep a very balanced perspective in your mind, and to consult with other people. If you think you have a safeguarding concern, obviously, speak to someone, speak to a professional about it. That's all, really. Thank you.
Thank you, Margaret. Margaret, thank you for that really thorough run-through and analysis, really, of some of those challenges, distinguishing between autism and the extent to which whether abuse is involved or not. So really difficult challenges, I think, really, but very nicely laid out. And I expect there may well be some questions, and we've got about 10 minutes for questions. So again, if you could please just say who you are and which organisation you represent. Thank you. So we have a question here. Gentleman with the brown jacket, thank you.
Hi, Margaret. I'm Ron Fortuna from Target Autism. I have a question really about abuse and autism coexisting. In my experience, I often find that if I discuss such a thing with other professionals, they tend to be quite dismissive and say, oh, it's just autism, and not take any concerns or worries that we might have about actual abuse occurring in the situation. Do you have any advice of how we can convince other professionals that it needs to be taken more seriously?
Well, I'd be inclined to remind them of the statistics that John gave you this morning, because I think they're very powerful. I think they speak for themselves. And I would also, it's a difficult one. I do think this is a difficult one. It gets back to sort of, professionals working in their little silos, and that's always such a problem. I suppose you have to be persistent and point to the evidence. Evidence needs to be very carefully gathered and documented, and I think multidisciplinary conferences can be useful too, because then there's an exchange between people with different professional backgrounds, and sometimes that can shift things along. But I think that is a problem.
I think it'd be incredibly difficult, and I would reiterate persistence and evidence. I think probably are the two key things. Absolutely. So we have a question over here on this side of the room.
Hello, Jan Loxley-Blount, Parents Protecting Children. A question about mothers and about girls. You had a slide that said that autism was 4 times more prevalent in males than in females. I think that might be an outdated statistic. I think there is growing understanding that there are an awful lot of girls and women underdiagnosed, and that in a way they're not diagnosed because the criteria were developed assuming male characteristics.
Yes, that's
and we
true.
haven't yet got criteria that fully understand the female presentation.
That's absolutely correct. My statistic there was simply this is what's in the literature. This is the sort of the official knowledge. But that is precisely because I should have said that. It's a good point that girls are probably underdiagnosed.
And in another slide, you said that the background of mothers with troubled backgrounds. Maybe a lot of those mothers with troubled backgrounds are because they are the very undiagnosed women on the spectrum.
Yes, that is absolutely true also. Certainly we think that's true of a lot of the children who come into care.
Yeah, because we're
that's
seeing that
right.
in Parents Protecting Children in the other organisations that we work with. We're finding a lot of instances where the problem is that the mothers are also on the spectrum, and therefore they're not dealing well with the professionals. They're perfectly capable of dealing with their children if they're left alone, but they're not very capable of dealing with the professionals. And so they upset the professionals, and the professionals get upset and start to try and remove the children, which makes the whole thing worse. And the antagonism between parents and professionals becomes worse and worse and worse. And it just needs some understanding that actually these might be terrified women on the spectrum.
Yes, I've had an experience of that. In fact, someone that we were assessing for court, and the mother didn't seem to understand that if she didn't turn up to the feedback session, that might be looked at as negligent. And so I spent almost an hour exploring with her why she didn't think it was important to come to her daughter's diagnostic feedback, because the professionals were getting very irritated. The daughter was being assessed for autism. And I realized that she just didn't get it. And then I began to ask about other things, and I realized that she was probably on the spectrum. So that, I totally agree with that point.
Thank you. And we have another question just over here.
Yeah, hi. I'm glad that Jan from Parents Protecting Children brought up the issue of women, because that's something that, you know, it's quite a difficult area for autistic women who are parents, because I think when we talk about, you know, we know, like from Tony Attwood's book, he says 48% of fathers of children with autism will have autistic traits themselves. We don't have any idea how many autistic mothers there are, because we don't even know how many autistic women there are, because women are being missed from the diagnostic process. And often women are receiving their diagnosis after their children are being identified. And unfortunately that's happening because when they're trying to engage with the services to get the support for their children, the professionals aren't understanding their communication difficulties. They're not understanding how that mother is responding to the sensory environment to access those meetings. She's being denied reasonable adjustments under the Equality Act because a lot of women fear getting a diagnosis and that perceived lack of empathy, when the role of as being the mother and the central unit of the family is that, you know, you're the caregiver, you're the heart of it. Well, and that's providing proving to be a barrier for women to access help and support for themselves. But that professional misunderstanding is not safeguarding the autistic children, because if a parent can't access the services, the child misses out on the services. And if a professional misunderstands a mother's intentions, which is a unrecognised autistic spectrum condition, and they take preventative or, you know, protective mechanisms within the family, you know, it's violating that child's human rights, the right to family, and it's preventable with more professional understanding. And at Cambridge University are doing a research project on the strengths and the challenges and the supports required for autistic mothers. And I think that when those results are released, I think that it hopefully should really help to bridge this current gap in knowledge from how professionals perceive a parent should be responding to their child and understanding the mother.
Okay, some really helpful comments there. Margaret, if you've got any specific responses to that, please do. If not, we've got one final question just here, if that's okay. Thank you. Thanks very much. So just one question here in the third row from the front.
Hi, Margaret. I'm Nada El Arabi from Building Blocks Therapy Center. You briefly mentioned about the factitious or induced illness, and I just wanted to ask if you can just give an example of a situation that we would see something like that.
To do with autism?
Yes. Or abuse, or just an example of a parent that would...
Well, I mean, I can tell you the sort of thing we might see at the hospital where I work, which is a child who sees lots and lots of different specialists with symptoms that are reported. And the child may be admitted and those symptoms aren't seen. And they get lots of investigations and the investigations are normal. And at some point people say, there's something puzzling about this presentation. You know, it's just not adding up. That's at Great Ormond Street Hospital, that's how it might present. And it's possible that a psychiatric diagnosis may be part of that picture.
Okay, thank you very much. Well, we're going to break now for coffee, and if I could ask everyone to be back at 11:30. Thank you. Thanks again, Margaret.